Dear esteemed guests, distinguished dignitaries, generous donors, and friends of UHAI Kenya NGO.
Thank you.
Hello, good people.
It is with a profound sense of purpose and gratitude that I am here today to share the story of our organization and the urgent need for your support. UHAI Kenya NGO is not merely a name, it is a testament to our unwavering commitment to the well-being of older persons in Kenya. UHAI Kenya NGO was founded by Edwin in 2011 as a self-help group, which has since grown into a dynamic NGO. Our journey began with the humble mission of educating communities on effects of alcohol and drug abuse and mental health wellness. Today, November 10th, 2024, we are making a significant impact in our community. Our diverse initiatives include providing medical care and psychosocial support to the elderly, organizing medical camps for accessibility of healthcare in the communities, providing psychoeducation on alcohol and drug abuse management, counseling and rehabilitation services. Our nation's elders, the pillar of our communities, have dedicated their lives to building the Kenya we know today. They have nurtured our growth, shared their wisdom, and shaped our destiny. Yet, as they age, they face a myriad of challenges: loneliness, isolation, poverty, and lack of quality care. Then how does UHAI Kenya NGO make a difference? Our social support programs create opportunities for older adults to connect, share stories, and combat loneliness. We also advocate for policies that ensure seniors have access to the resources they need and offer economic empowerment initiatives to help them achieve financial stability. Our community engagement activities foster a sense of belonging and intergenerational interactions. About medical checkup, we had volunteer clinical officers, nurses and nurse aides from Thika Level 5. Hospital nurses attended to older persons by taking their vitals, that is blood pressure, blood sugar, and also diagnosis and prescription and referrals. We had a medical talk from Thika Level 5, a senior doctor from Thika Level 5 who was giving a medical talk. He addressed common ailments for elderly persons but put emphasis on blood pressure and blood sugar. On April 1st, 2024, we were celebrating Easter. UHAI Kenya NGO had a date with grannies. A group of 236 men and women from Budhoro East gathered at one of the older person's homestead during the morning session, and in the afternoon another group met in a PCEA church with an attendance of 224 old men and women. On that day we reached 460 old men and women. We had activities like storytelling by older persons. We had activities where the older persons shared their experiences and their feelings towards their journey in old age. They expressed the desire to get together forums often, and if possible come up with programs of psychosocial activities which can bring them together and spend time together. They also requested if such meetings can have economic aspects tagged on them. We also had a cup of a break. We had a cup of porridge. The MC informed members that there was a cup of porridge and a snack sponsored by one of the guests. She observed that she meets older persons in the group. It reminds her late parents and grandparents. She dedicated her love by sharing a cup of porridge to all present members. UHAI Kenya NGO CEO, Mr. Edwin, expressed his heartfelt gratitude for meeting the grannies again after the UN activity in October 2023. He narrated the support he had received from friends and well-wishers who shared their money, food items to be shared out to the grannies. He invited all the guests who had accompanied him for the event. Each guest introduced themselves, where they came from, what they do, and their attachment with older persons. Mr. Edwin recognized all who had contributed or given their moral, financial, and spiritual support but were unable to attend the event. In 2024, UHAI Kenya NGO conducted a medical camp with the support of Lions Eyesight Hospital, where we had a total of 32 patients were seen with cataracts, and 44 patients were seen with ear, nose, and throat challenges, and also the general illness, where more than 270 patients consulting for general illnesses, where 80% were noted to have blood pressure. Among them were unaware. We also had the moment of psychological counseling. The Aging Dignified Kenya, a group led by Madam Jane and Josephine, conducted a group and individual counseling sessions. 7 clients were attended to, with 3 cases that required follow-up and referral. On 16th of September 2024, we had a moment. We celebrated World Dementia Day. We had support from organizations like Women for Dementia Africa, Aging Dignified Kenya, Help Age International, Non-Communicable Diseases Alliance of Kenya, Community Health Promoters, Chromanon Dietary Supplements, Mikop, and Sukun Foundation. It is therefore against this background, dear guests and delegates, that we come humbly seeking for your support. Your generous contribution will help us to meet healthcare and wellness for older persons. This will include medical camp on ENT, diabetes and hypertension, psychological counseling sessions for the older persons who are psychologically disturbed, training on HIV/AIDS awareness and the consequences, dementia awareness, as well as drug abuse prevention. These are some of the challenges that we are experiencing with older persons. We also expect that you support in social support, where we will organize social activities like tree planting, traditional dances, storytelling, and support groups to help seniors engage and end the feeling valued members of the community, creating opportunities for intergenerational interactions, as well as ending loneliness, which is a big challenge in old age. We also hope to advocate, to create advocacy. We advocate for policies and initiatives that ensure seniors are treated with respect and have access to the resources they need. We also wish to raise funds to purchase clothes, beddings, and dry food stuff for the older persons. We realize that most of them, they are experiencing hunger, they are due to poverty. We know with your support, we are going to raise enough funds to cater for all the needs that have been mentioned above. We welcome you to donate generously, and we will keep you posted. We will keep you updated on how the funds will be utilized. Thank you very much. Thank you for your support. Thank you for your presence. God bless us.